again, thank you for being here. Today, we'll look at homelessness not as individual failure, but as the product of interacting systems, housing markets, wages, health, justice, and policy. Data reveals patterns. Systems thinking explains why they repeat. My goal is to connect empathy with evidence so we can design what works in practice. By the end, you'll see why housing first isn't just compassionate, it's structurally sound. It reduces churn, improves outcomes, and aligns with how real systems behave. If we learn to see flow, and that's going to be the visualizations, feedback, and leverage, we can stop arguing over snapshots and start changing the system that produces them. Here's the roadmap for today. I'll start with how I came into this work, then we'll introduce systems thinking and how it reshapes what we notice and measure. We'll connect those ideas to housing first, review what the evidence shows, and then move into system flow, stock, inflow, outflow, and the feedback loops that drive change. Finally, we'll end with concrete steps your community can start tomorrow. The goal is to have and to move from good intentions to good design, using data as a feedback instrument, not a scoreboard, so our efforts compound instead of recycle. Homelessness is complex, and stories alone can't explain why it persists. Data shows patterns. Systems thinking shows why those patterns repeat. It reveals the flows in and out of homelessness, and where our interventions help or harm. When we combine housing first with a systems lens, it stops being a philosophy and becomes a design principle. Stabilize first, then support. That simple shift turns chaos into a system we can manage. This isn't about blame, it's about understanding pressure, rhythm, and leverage so we can intervene where change lasts. So, who am I? Well, I spent 20 years managing radio stations. I started out doing that, enjoyed it immensely, it was a lot of fun. I was in Indiana, Cincinnati, Ohio, Lexington, Kentucky. Spent some time actually out in Cherry Valley, New York, so I was able to travel and do some work around the country. And then as far as education, I have AS in Information Systems from Purdue University. I also have a business administration bachelor's degree and a master's in database management and systems intelligence. So I started as a data analyst after I did my radio gig, and I eventually became a chief technology officer of a COC in Charlotte County, Florida. I now build data dashboards for organizations nationwide, and honestly just kind of do consulting and just help COCs do the work better if they can. And something I do want to point out is that this is my son, and I hadn't seen him for 2 years, and I went out to Los Angeles in February where he's currently homeless. And we're working on bringing him home, but it's difficult. I'm sure as many of you know in this work, everything can be way more difficult. But I was able to see him. I went to a conference out in Los Angeles, was able to find him. We're working on reunification, but it reminds me that this isn't just work, it isn't just statistics. This is personal and it's also moral. So as a data analyst down in Charlotte County, Florida, I was right there in the back left. It was a great experience, I'm not gonna lie. It was a kind of a one-stop shop. We had street outreach down the road. We had a soup kitchen, cafe. We had food pantry, emergency shelter, rapid rehousing. So I really got to learn the in and outs of the homeless system by working at that good organization. Eventually, I actually served on the board of the same organization. So just trying to, help make sure things were aligned right and kind of continuing the mission. So I highly recommend board work if you've never had the opportunity. It's a really interesting way of guiding an organization from like a higher perspective, and it's a really great experience. And they're always looking for people that have different kind of expertise to do that kind of thing. So it's really cool. I highly recommend it. So for decades, our system was built on rules, curfews, sobriety, compliance milestones. The idea was that people had to prove readiness for housing, but the cracks showed fast. You could follow every rule and still fall through. Data told a different story. Communities that housed first, then offered voluntary services, achieved better outcomes at lower cost. Housing first marked a turning point, from enforcing steps to creating stability, from deciding who's deserving to designing systems that work. Now this next slide, some people now use AI, and I spoke on AI, and I think it can help a lot of capacity building, but I was using AI for picture generation, and I realized that I'm not too bad of an artist myself. So, this was the old model, the stairway to success. The logic was simple. Climb the steps, get sober, find work, complete treatment. Then you earn housing. Each step came with conditions: sobriety, curfews, mandatory check-ins, employment rules. But look closely. Each step is another place you can fall off. For people already struggling with trauma or poverty, this wasn't a path upward, it was an obstacle course that rewarded luck, not readiness. The old system failed because it was built on the wrong assumptions. It assumed homelessness was about bad choices, that if people just followed the steps, they'd reach stability. But people entering these programs were already carrying enormous pressure: trauma, poverty, mental illness, addiction. The system added more on top. Those cracks in the staircase, that's where people fell through. Not because they didn't try, but because the structure itself was unstable. It wasn't a staircase to success. It was a stress test that almost no one could pass. Instead of climbing a staircase full of rules, what if we just jumped over it? What if stability, a safe, secure place to live, came first? That's housing first, not housing only. Instead of making people prove readiness for housing, we give them housing first and surround them with support they need to stay there. It replaces judgment with evidence and obstacles with opportunity. It's not about skipping accountability. It's about reordering the approach so people can rebuild, not climb. Housing first provides a foundation for recovery instead of a staircase to nowhere. Also in my notes, when you see statistics or anything that needs backed up by proof, in my speaking notes, I have links to the original studies, articles, whatever it might be. So everything I have is cited and documented within the speaking notes. That being said, housing first has been proven for 2 decades. HUD studies show 85 to 90% housing retention rates. In Sam Simbaris's Pathways to Housing study, nearly 9 out of 10 people were still housed 5 years later. Health outcomes improved, emergency room visits and jail stays dropped by half. Financially, communities saved $9,000 to $30,000 per person each year. Housing first isn't just compassionate, it's evidence-based design that improves lives, reduces costs, and strengthens systems. Stability first doesn't just work, it changes everything. So, housing first is a simple idea with profound results. And I think the slides may have got switched on that, but the percentages were all there like I was talking about. But the whole point of it is data backs this up. When people have a safe place to live first, everything else, treatment, employment, recovery, becomes far more achievable. Housing doesn't just end homelessness, it creates the conditions where positive permanent change is finally possible. This is Dawn Wade. She lives in one of Maine's Housing First communities. When asked about her home, she said, "This is home to me. It's a community here. I don't know where I would be if it weren't for this place." I like the community part because that makes a huge difference. It's not just, isolation. The ability to better yourself when you have others around you is incredibly powerful. So that's the real outcome. Not just retention rates or cost savings, but stability, belonging, and dignity. When people move from surviving to living, everything changes. Health, relationships, hope. Each data point we see, and we'll see today, represents someone like Dawn, who just needed the system to give them a fair start and a foundation to rebuild. Hi. That's the gnome. When I don't do well, he looks at me weird. You want a cookie? You gotta feed the gnome, I guess. You just roll with it. All right, so now that we've seen now that we've seen how Housing First changes outcomes, let's zoom out even further. Up to this point, we focused on, this is not a big enough cookie. I'm just gonna stay, everybody's got insurance, right? We're all good? Okay. So I've established Housing First, but now we're gonna step into a little bit different dimension, hopefully. We're gonna look at how systems behave. We like to blame individual people, but let's see the other side of that coin. Systems thinking is like putting on new glasses. It helps us see homelessness not as isolated people or projects, but as movement. People flowing in and out due to pressures, barriers, and supports. Once you see that flow, you can't unsee it. The numbers we track aren't just counts, they're signals of how the system is performing. So systems thinking teaches us to see relationships instead of parts, and change over time instead of snapshots. When we only look at static numbers like the point in time count, we're seeing a single frame of a movie. It tells us how many people are homeless, but not why or how that number shifts. In fact, we generally ask, where did you sleep last night? We didn't ask, where'd you sleep 3 weeks ago that you lost whatever, your housing, and now you're here. We just want to know about last night, which is kind of odd. So we know how many people are homeless, not why that number shifts. Systems thinking lets us step back and watch the whole film to see causes, pressures, and feedback loops. Once we start seeing those patterns, we can design smarter, lasting solutions instead of reacting to the moment. Oh no, the number went up this 1 year. How we frame a problem determines how we solve it. A mental model relies on assumptions and quick judgments, useful for small issues, dangerous for complex ones. In homelessness, that model says the problem lies within individuals a lot of times. They need to work harder, get sober, follow rules. A system model zooms out to show relationships and feedback loops, the forces shaping outcomes. When we shift from what's wrong with this person to what's wrong with the system producing this result, everything about our response changes. Let's look at how mental models fail. Traffic, add more lanes to reduce congestion. Seems obvious. Oh no, that actually makes it worse. Forest fires, stop any kind of burning you see, and then fuel builds until a mega fire erupts. Antibiotics, overprescribe, and we create resistance. The logic for a mental model feels right, but fails over time because it ignores the system's behavior. Homelessness works the same way a lot of times. When we only focus on individuals, we miss the feedback loops driving the problem, and end up reinforcing the very cycle we're trying to fix. When most people think about homelessness, the mental model kicks in. Bad choices, addiction, laziness. It feels simple and personal, but it's wrong. That thinking shapes policy too. If we believe homelessness is caused by individual failure, we design systems that punish or fix people instead of addressing the conditions that produced the outcome. The truth is, homelessness stems from system pressures, rents, wages, health, justice, and bias, not from personal flaws. Until we shift that lens, we'll keep treating symptoms instead of causes. Here's how the mental model plays out. Bob sees a pillar blocking his way, decides to push it over to make more space. From his view, it's a simple, direct solution that feels right. But mental models do that. They create confidence without clarity. They make us act quickly before we understand the system we're part of. Homelessness works the same way. We make decisions that seem helpful but ripple outward in ways we can't see. Let's zoom out and see what really happens to Bob. When we pull back, we see that the pillar wasn't standing alone. It was part of an interconnected system. Pushing one part caused ripple effects that circled right back to him. The action that felt like progress actually made things worse. That's the power of systems thinking. It helps us see how one small move can create large unintended outcomes. In homelessness, the same thing happens when programs make isolated decisions without seeing how they interact with the rest of the system. Let's bring that idea back to homelessness specifically. Imagine our community's point-in-time count finds 50 people experiencing homelessness. It could be 5,500, whatever number in your community. That number feels solid, but it's just a snapshot. One frame of the movie, like I said before. It tells us who is homeless tonight, but not how they got there, how long they've been there necessarily, or found housing afterward. In systems terms, that's the stock, like taking a photo of a river and calling it a lake. To understand the story, we have to see the movement underneath, the inflow and the outflow that shape that number over time. So if we start with 50 people in our count, over the next year, our community does everything right. We house all 50. None return to homelessness. Every single one. On paper, that's success. 0 left on the list. This represents outflow, the movement of people out of homelessness and into housing. But systems thinking asks us to pause before celebrating. What happens when we look again next year? That's where the real insight begins. Because without addressing inflow, the count may look exactly the same. A year later, the count still shows 50 people, or 50 people again, but they aren't the same 50. The public asks, why aren't the numbers going down? The answer is inflow. If people are entering homelessness as fast as others are leaving, the total stays flat. If inflow grows while funding doesn't, the number rises. It's not failure, it's system pressure. The mental model says the system failed. The systems model reveals what's really happening and points to where we can intervene upstream. Let's imagine emergency rooms. No one expects one to be empty. We know new patients will always come in. We judge the ER by how well it responds, not whether it's vacant. But with homelessness, we expect 0. Even as rents rise, wages lag, and people are discharged with nowhere to go. That's like expecting an empty ER during flu season. The real question isn't why isn't it 0? It's what are we doing to stop the pressures filling it? That's what systems thinking teaches us to ask. You know, if you keep having people show up in your ER with bullet wounds, You know, you don't just keep treating them. You go, well, who's shooting them? Or if they're bus accident victims, you know, what's going on? If you keep having traffic accident victims, maybe see what's causing that. If you got 500 over the course of a 30, you know, it doesn't seem too hard but it's weird that we have it almost figured out, or we have a better idea, I think, when it comes to healthcare. But with homelessness, which can operate in a similar fashion of inflow, outflow, we don't necessarily back that far up. We just want to go, oh, it was the mental illness, oh, it was the addiction, which is interesting because many, many, many millions of people live in housing across the country with mental illness, with addiction, and with all kinds of things. But it's interesting how small a percentage actually end up homeless. Most people imagine homelessness as a static number, like we saw, 50 this year, 50 next. The mental model says the system's not working, but that view is misleading. It traps us into blaming individuals or the response system itself, instead of asking what pressures keep this number constant or rising. Like Bob and the Pillar, we focus on what's visible and feel certain we understand it. But when leaders design solutions around that illusion, like adding shelters that maybe don't need to be there, or tightening eligibility even harder, or having shelters that aren't, housing first, they have a lot of barriers to let people even stay there. They have to get kicked out and all kinds of obstacles. They miss the flows that actually drive the problem. So now we're gonna zoom out again. So it's still the same people in that stock we had, but this time we add inflow and the story changes completely. The question isn't whether the number goes up or down, it's whether inflow is being managed. Here are some examples of inflow, also known as system pressures, that you may or may not have discussed. Rising rents, wage stagnation, predatory lending. I have a friend that she's in her 20s, has autism, and a pet store sold her a $3,000 dog with like all the kinds of percentages on the loan, and she had to pay for it for so long. And this person, worked at, like McDonald's at part-time. I mean, they couldn't afford a $3,000 dog, but, predatory lending with the percentages and everything. And trust me, the dog didn't cost that much. It was like a $500 dog, but when you got past the financing and all the interest rates, it became a $3,000 dog. And that's, there's lots of worse ways people are taken advantage of that we don't necessarily consider. And that's where we have policies to protect people. So evictions, domestic violence, foster care exits, hospital discharges without housing plans. We've had people at the shelter show up from the jail or the hospital. Now, they got better. They used to have people from the organizations drop them off, but you could talk to that person. It's a lot easier with Uber. They just drop the person off at the shelter with nowhere to go, and you're like, oh, okay, I guess we're taking care of them now. But the jail or the hospital is causing that homelessness. It's kind of sad. These aren't abstract. These are real forces pressing down daily. Unless these pressures ease, the faucet stays open. We have to stop asking why are individuals failing and start asking why is the system producing homelessness? The answer tells us where real prevention begins. Here's another word cloud, and this one looks more at system pressures and what's causing homelessness. As we can see, it's way different from the individual causes we were looking at before. But here's the thing. Blame the system and you get prevention, investment, and stability. Narrative isn't side work, it's strategy. Now let's connect it all. Stock inflow and outflow. Inflow pushes people in. Outflow, which are housing placements, vouchers, services, moves people out. When we see both, the picture makes sense. The point in time count stops being mysterious. Housing first fits perfectly here. It speeds up outflow by stabilizing people and reducing churn from returns. That stability also frees capacity to address inflow. The question isn't how many people are homeless tonight, but what's happening with inflow and outflow, what's happening in the system. And once we understand that balance, we can manage homelessness as a whole system and not just a snapshot or not just on outflow. So we're gonna look at how we can control outflow and what we are responsible for, things like permanent supportive housing placements, rapid rehousing programs, affordable housing development, family reunification, lots of different ways that we can manage outflow. So I'm going to tell a story. The water pressure in my room is incredible. I don't know about your guys's, but I mean, I put it on, like splashed me kind of thing. I was in the shower, and the interesting thing is, my bathtub will fill up as I'm taking the shower. And I was like, wow, this is okay. Now, in this situation, I can't control the outflow. It's the drain, right? So I don't just go, well, nothing I can do about this. Water's on the floor now. No, that's stupid. I'm like, oh no, there's more water coming in constantly. And it's a simple solution. I just adjusted the water pressure. So I didn't just look at, I wasn't myopic. I didn't just look at the drain. I looked up and I looked at the system pressures that were increasing the stock in the bathtub. And I thought, oh my gosh, I'll talk about this today. And people will stare at me weird. But it works. And you think about that and it's like, it's so, the problem with some of this stuff is it's so no-brainer that when you say it to someone, they're like, yeah, that's obvious. And then they want to act on it because they don't realize it is actually kind of a revelation. We need to put the pressure where it belongs, and that's upstream. So here's where the lens becomes a blueprint. Stock data, like the pit count, gives us one night's picture. Who is homeless? Not why. And inflow, or add inflow and outflow, and the story deepens. Inflow shows pressures like rent and wages. Outflow shows existing cracks in the system. Together, they reveal how homelessness behaves. Instead of try harder, systems thinking asks, where do we push? Do we slow the faucet, widen the drain, or seal the leaks? Seeing those dynamics turns debate into design. This diagram is messy because real life is messy. It maps feedback loops, how housing, health, work, policing, and stigma amplify or ease homelessness. Some loops spiral outward or upward, others down. Rising rents can cause evictions and worsen health, which makes employment harder. But supportive housing can reverse the loop. Stability leads to income, income reduces returns. The key is we can't hold all this in our heads. Modeling reveals where small, well-placed moves can create big, lasting change. This visual shows where leverage lives. At the bottom are weak levers, metrics, materials, short-term tweaks. They're visible, but rarely transformative. Higher up are harder, more powerful levers, shifting resources, rewriting rules, creating new feedback loops. At the very top are cultural levers, changing beliefs, goals, and purpose. Once we shift how people think about homelessness, everything downstream changes. It's not what can we fix, it's are we aiming high enough to change the system itself? When we blame individuals for homelessness, we set ourselves up to fail. It ignores the bigger forces at play. Focusing only on the stock, the count, just recycles people and leaders through the system. I've lost more friends in the last 8 years to go on to different positions out of homelessness than I can remember, and they are some of the most incredibly talented, skilled, and intelligent people I've known, but the system itself pushes them out. It ignores the bigger forces at play. Focusing only on the stock, the count, just recycles people and leaders through the system, like I said. Communities look like they're failing even as they house people daily. The true causes are upstream, like I mentioned, rent, evictions, discharges. Where we assign responsibility determines what strategies we choose. Blame people and we punish, recognize pressures, and we design solutions that work long-term. When we blame individuals or even the COC itself, we miss context. COC leaders are often fighting huge inflow pressures driven by bad policy. Across the country, criminalization laws are rising. No sleeping bans, arrests, curfews, these don't reduce homelessness, they worsen it. pushing people deeper into instability and into profit-driven systems like jails and prisons. A lot of people don't realize jails and prisons are profit places. You can make a lot of money off people through phone calls and lots of different ways, a lot of ways to profit off of prisoners, unfortunately. Meanwhile, groups opposing Housing First exploit blame for political gain. This isn't cynicism, it's awareness. Even failed systems generate profit. And that makes change harder, but not impossible. Housing First is the counter model. It's not housing only, it's housing first, then support. That order matters. Without housing, health, work, and recovery wobble. With it, they stabilize and grow. Housing First widens outflow, reduces returns, and lowers costs. If homelessness is a bathtub filling faster than it drains, Housing First is the tool that clears the drain and seals the leaks. Punishment increases churn. Housing First creates stability. One keeps the cycle alive, the other breaks it. All right, I'm going to skip some of these slides because I want to get to some of the more visualization stuff. But I do want to kind of touch on some of this. Let's see. So yeah, Housing First taught us what works, stable housing with support. Systems thinking shows us how to make that stability last. It's not just about helping individuals, it's about designing structures that make stability predictable. Data turns that design into feedback, showing where things move, stall, or break. When we combine compassion, design, and data, we move from philosophy to precision. This is how empathy becomes architecture, building systems that make good work the default rather than the exception. So I'm going to show you a few things that are possibly in the toolkit now of people that work in homelessness. So HUD's system performance measures were the first real attempt to track homelessness as a system rather than separate programs. But without context or feedback loops, really this is limited for diagnosis. It can't do a ton for that. We kind of need more than just system performance measures that are kind of that snapshot we were talking about. The longitudinal systems analysis, or LSA, is another tool. It's, again, kind of out of the hands of the community, really. They gather the data and send it up to HUD. HUD then takes that and uses it in the annual homeless assessment report to Congress. But the community doesn't generally use the LSA necessarily for improving their own system, unfortunately. Its limit is its scope, like I was saying. It does track what's inside the homeless response system, but it doesn't really track the external pressures that are feeding it. So it's a powerful x-ray of system health, but not the full body scan that is needed. There's also a federal tool called Stella. It does take things a little bit further. Stella P for performance shows how inflow, outflow, and inventory interact over time. Stella M is for modeling. It lets communities test what-if scenarios. What if we expand prevention or rebalance rapid rehousing and supportive housing? It moves us from describing the past to rehearsing the future. The models aren't perfect, they simplify reality, but they let us simulate choices before we spend a dollar. Used well, Stella is a flight simulator for strategy, helping leaders see consequences, debate trade-offs, and design change collaboratively. But again, this is really on just improving the system and that outflow portion we were talking about. Now, when we evaluate other tools and we start moving into visualization, we have things like KPIs, or key performance indicators, like how many people are homeless today. Feels concrete, but again, it hides movement. It doesn't show how many entered or exited, how many will return, or how trends are changing. It's a still photo of a moving river. The system might be improving or worsening beneath the surface, and we'd never know. Even the system performance measures only look at a two-year snapshot. The system might be improving or worsening beneath the surface, and we never know, like I said. When we rely on static numbers, we manage by hindsight. The key is turning snapshots into motion pictures so we can anticipate, not just react. So let's unfreeze the frame. When we add inflow and outflow data, we start to see these peaks and valleys, these rises. We start to see what happened over time. The system starts to breathe. The line rises and falls, people entering and leaving. When inflow exceeds outflow, homelessness grows. When outflow outpaces inflow, it shrinks. That rhythm reveals balance or imbalance. Once we can see that rhythm, we can act intentionally to change it. Data stops being a report card and becomes an instrument panel, something we steer with, not just measure. Here, flow becomes measurable. Each month, we track how many people enter versus how many leave. When inflow stays higher, the total rises no matter how hard we work. When outflow overtakes inflow, the stock drops. The balance point, the intersection of the two, is the system's heartbeat. Every policy choice, prevention, housing expansion, eviction reform, shows up here. The goal isn't perfection, it's a rhythm, steady, of reduced inflow, strong outflow, and reduction over time. This is an example of a homeless system flowchart. It shows the situation that people were in when they entered the homeless system, what project type they were enrolled in, and the exit destination when they left. The overall idea is to have lots of red on the left and very little red on the right. And conversely, a little green on the left and a lot of green on the right. When we zoom in on this example community, something stands out. Most people did enter from homelessness, but many are exited to other. That's not a real destination. I've never been to other. It's missing data is actually what that is. Sometimes it means no exit interview. Sometimes staff didn't know. Sometimes it was entered optimistically. I like the optimistically part because a lot of people are exited to stay with friends and family permanently. And permanently a lot of times means like 2 weeks. It's not permanent. And then they get returns to homelessness. So sometimes that's not always a great way to say stuff, but other's not a healthy option. But when other grows this large, the numbers stop telling the truth. It hides real outcomes and inflates success. Good data isn't about blame, it's about learning what's real so we can fix what's not. Okay, this isn't of a community of like 300 homeless people. This is actually a system I'm working in. Over the course of a few years, they dealt with 140,000 people in their community, and they send that many, it's a top 20 city in this country, and they're sending that many people to other. This is a tiny little, I'm not gonna say tiny, but compared to 140,000, we're looking at a few thousand people here at a smaller community in Rochester, New York. This is a person-centered housing options. And this shows people entering directly from homelessness on the left and green permanent housing expanding on the right. That's amazing. The red nearly disappears. That means their system is doing exactly what it's designed to do, moving people from crisis to stability. It's proof that Housing First works when implemented at scale and supported by alignment. Data isn't just measurement, it's storytelling for progress. So I'm actually going to switch over. I have more slides that talk a little bit about systems thinking, but I want to do something real quick if I can. And bring up, give me just a second, I'll put the mic down. And this is just an example of what a data dashboard could look like for a community. It's going to take a second to load because this has thousands of rows of actual data. It's all been protected, all the IDs have been hashed, and personal identification has all been removed and deleted, no names or anything like that. But now we can see things like household flow. And now I see what I love about visualization is I see this blue over here, and I'm like, why is there a spike? And I can hover, and you may not be able to see this, but it'll give me the exact numbers for that time period. Or I could go over to a dip, and I could look at that. So visually, rather than combing through spreadsheets or all kinds of weird stuff, I can just go, oh, why is there a spike? Why is there a color? Why is there a this? And I've layered the data in here, and you can see. Now, I do love this. This community has almost no child households, which is great. Some communities, most communities do pretty well at this. I have seen some that it's not okay, and a lot of times I'm going to say that can be based off of what programs they have in the community. So, yeah, you have a question? Yeah. Let me see. I mean, I say yes, but let me see. I admit I don't use. Oh, this is. I might be lying. Well, I won't stay on this too long because I'm going to take some questions, but I just wanted to show you what an actual dashboard would look like. But what's cool about this is has the system flow, but what's neat, and anybody can check this out, it's at gaitherdyne.com/demo. But if you go into the settings on the back, you can actually change the projects, the project types, the dates. You can control population types, so if you only want to see one type of household, if you want to just see female veterans between 25 and 34, you can filter for that. So this allows for full ad hoc reporting outside of HMIS. And transparency like this is what can help us really drive narrative about homelessness. Yeah, question back here. No, so what happens is, and there's lots of different solutions similar to this. So a lot of times what will happen is in HMIS, Homeless Management Information System, you have the ability to export data. They have a tool called the hashed HUD CSV, and you can export data and then upload it into different tools. I was actually talking to Tino. There's a tool online called EVA, EVA, and that's a federal government provided tool that you can download your data and upload that. And the other tools I showed too, like the Stella, you upload that data and there are tools that will examine it for you. So HMIS, while they in the future may be becoming more analytical, a lot of them are really just doing the database and the case management kind of stuff. A lot of the tools that have to be used to do this kind of work, honestly, are external to HMIS. So you have to download the data and then upload it. So for example, this, let's say you download the data last week, upload it, and then until the next data dump, it's, so this might lag by a week or two or a month or whatever it might be, but generally, the communities will update the data once a month, but this does have all of the data that would be in HMIS pretty much. It's just made sure that everybody's protected at the client level, but then you can go through, and like on this, if I wanted to, I could just do, and I know it's kind of hard to see, but I could just look at my housed population, and I go back to the dashboard and I can see what that looks like. So this just provides more of a flow kind of a thing. I've seen communities where they think everything is fine, but then all of a sudden you mean, one of the communities I'm working with right now, it's just a steady climb of increasing homelessness. Now, that may be them, it may not be them. That requires a little bit further analysis, but this just takes us that step farther from going from that one singular number to stepping closer. There are actually metrics that I'm working on that are gonna be hopefully bringing flow in more, but one of the problems is you can only report out what you collect in. So currently, we just ask, where did you sleep last night? But most people don't necessarily go straight from the thing that caused their homelessness right to the agency that's gonna collect that information in that one 24-hour period. It's not like they go straight from jail. I mean, sometimes that happens, but many people will be placed not meant for habitation, but that's not really accurate. The woods didn't cause their homelessness, so it's an odd, so I almost think we need a separate data collection point that is like maybe a little more softer, but what caused this episode? And then tracking that kind of stuff and working on getting more upstream, and this is how we can kind of do it. This helps us tell a little bit more of a, I guess, complete moving story, because like this visualization here, you can see these blue spikes, and the blue spikes would be outflow. So that's good, the system's doing good things, but in other systems, you'll just see red spikes and the blue spikes are very low, and that's an inflow problem. So it's really easy to differentiate out and say, okay, is this us doing our job well? No, this is the system creating way too many people in homelessness right now. So it's just, again, using these tools and expanding the toolkit beyond what's just handed out to us free by the federal government. I do want to go back real quick to the slides, because I want to show you there are, the demo I just did, and that I just showed you briefly, the link is here if you want to check it out. I also have some additional slides that are a little more in the weeds, but my speaking notes are there, and they talk about what's beyond system flow, so what comes next. So there's some really cool stuff in here to kind of explore. There's actually, MIT has a whole systems thinking institute that's really cool. Systems thinking by itself is a really neat topic, and I think it could be really used well in our community if people started adopting it more. So again, these slides are here. I do want to take some questions now, if anybody has some questions about what I've talked about. I was kind of doing it as we were going, but yeah, let's go back here. Yeah, no. Who's your vendor? Who's your vendor? Who's your, what system do you? Oh, you use WellSky then, right? Clarity. Oh, Clarity, that's right, you switched, I forgot, that's right, Clarity. Okay, I was just curious. Yeah, so there's lots of options, honestly. I mean, well, lots of options, but so I build dashboards for communities, and a lot of them, especially the organizations, I do cost-based, so if your budget's $8 million, the price is way up there, but if your budget's way lower than that, then they're lower. But honestly, sometimes visualization doesn't have to be even this fancy. You know, sometimes it can just be able to understand the tools like Stella. You know, that's a tool that exists that you might be able to use. And I do virtual meetings. If people want to schedule a meeting with me afterwards, I'm happy to share other resources and other ways in the community to improve. I will have cards up here actually too, so feel free to grab a card and meet with me. A lot of it I just do, I do build data dashboards for communities, but a lot of times I also just give free advice, because I know it's a hard community to work in. And in fact, I built a community online called the COC Alliance, and we have about 1,700 members now. And if you go to cocalliance.org, it's just a Slack channel, which is just real-time chat, and people just drop in there and they're like, oh my gosh, I don't know how to do this COC NOFO, or I don't know how to do this rapid rehousing component with transitional housing, can you help me? And somebody from Denver will be like, oh yeah, we do it here, blah, blah, blah agency, and they help each other. So cocalliance.org is a free thing that just, if you need help with COC issues or HMIS issues, sometimes it's a great place to kind of commiserate and help each other as peers and colleagues. So I like to let people know about that. All right, any other questions, comments, anything we'd like to cover right now? Yeah, right here.
I have a question. It's not necessarily about the systems, but about housing first. So where I'm at right now, there's a big emphasis on getting our people document ready for housing. And I've been finding that that's been a barrier, because you have to wait for the Social Security card, you have to wait for the birth certificate, you have to, all of this stuff. So I kind of feel like it defeats the purpose of housing first. Is there a community that actually does housing first, where all of those things are not mandatory? And where is that?
Well, so, and I'm sure there's people in the room that can help me with this, but a lot of times I could say, for example, Maine maybe has done a great job with housing first. But what you're running up against might be reporting requirements or contract requirements. So you're probably, that might apply to Florida or whatever state you're in versus Maine. So stuff like that, I would say maybe one of two things. It could be a business process problem where there are ways to just speed that up, and just by somebody going through the system or thinking ahead, going, oh, we could probably do this faster, or we could have a text, an agency or person, we know somebody at Social Security. So there's the business process side of it that may be able to be worked on. The other part would be higher up. It's, you know, if it's DCF saying that you have to have all these things ready, then maybe talk to DCF. You know, talk to the person. I mean, ask yourself, what's causing that? Why are we having this delay? I mean, we know that we have to be document ready, but why? Is that a COC policy? Is that an agency policy? Or is that a funder policy? What's the actual cause? And so this applies, you know, systems thinking kind of applies in a lot of different ways. So go upstream. You know, it's frustrating to have those things, but why? Why are they there? And sometimes they can be changed and eliminated if you just review it. Yeah, Tara.
That's a great example of systems thinking, and I've had the benefit of working in multiple states with systems now. If you're, agencies tend to hold on to things, right? They want to own everything. They want to own the documentation, and that it's their client. And when you're really thinking of a systems approach, a best practice is getting documents and making sure clients have those, because you need that. You do need those tools. That should be happening in street outreach and outreach models. And that can be one of the things that they build relationships with. How can I help you get this, right? And that should be saved and ready to pass on to the next person. And that should not be a barrier when you're at an emergency shelter or a housing project. That should have been done in other places. If you don't have a strong outreach, it can be done at an emergency shelter. It shouldn't mean the person can't come to emergency shelter, but how are we focusing on your long-term solutions at emergency shelter? And one of the key things, again, you need identification. You need those things to move to your next step. How can I help prepare you for your next step? So, but it requires people to be willing to work together, not own things, and be ready to help the person and pass them on to their next step.
And I also think the fact that you identified that as a barrier is incredibly insightful, because people just go, oh, but it's part of the process. It's just what you have to do. Yeah, if you're waiting for like 60 days in the woods, I mean, if I'm waiting for a hotel room and I gotta wait 60 days, something's wrong. That's a big obstacle to get in my room. So that is a barrier. But a lot of times, now those could be, document ready can be like a funder kind of requirement, but it could also be, oh, okay, apparently it's working on its own. I ran into a situation when I was in Charlotte County where we had ROIs, releases of information. And our ROIs was one sheet of paper per person. So we had 8 sheets of paper, and it had all this documentation and all this stuff to be filled out, and it took forever. The more people you had in the family, the longer it took. And we got to researching it, and it was like, and that was an obstacle. That was a barrier, because it was a pain in the butt to do. And it was hard for us, and it took up our time where we couldn't serve the people as good as we should have. So we reduced that to one sheet, and all the signatures on one signature, all the people listed, and it was all within our policies and guidelines. And if it wasn't, we could have changed them. That's also possible. Things aren't set in stone. That's why you have committees that change those things. But eventually, we completely removed ROIs from our system, and we're able to do that. And then we just have notices at the locations. So you should always honestly be revising your business policies, and as you see how your system actually works, modify it a little bit. And if, do some measurements. Okay, this person, it took them, document ready. There's 8 different things on there. If 7 of those things happen in 30 minutes and 1 happens in 8 days, focus on the one that takes 8 days and see if you can eliminate that. But a lot of times it's just really simple business processes. And for me, this is the biggest thing I can honestly say is if you're high up, or even if you're not, go to other organizations. If you work with organizations, if you're at a large COC and you've got agencies underneath you, visit them, see how their processes work. And the idea that you may have in your head may not work well on the ground. Maybe their one office is here and their other offices across town. They can't do something simple that maybe you can do because your colleague is in the next room. So sometimes it's just as simple as, walking through it step by step and then seeing where we can make improvements. But it is generally, I would say, a lot of the pressure that we're seeing is upstream, and that's where we can make some really powerful changes, but we got to be able to be willing to do it. Yeah.
I also want to, I guess, piggyback on that. My organization, I work with veterans, and that's like one of the biggest barriers is having them document ready. It's crazy how, to me, and I just can't see, and no one really complains, and we complain amongst each other, how VA will get a third party to get a DD 214. I'm a veteran. I know I can get it where I can get it. I know how there's offices where they'll set you up where you can access all of this. On top of that, there's the other organizations who are actually interacting with the veteran day to day, and they will still come to us, a third party, hey, I need this document. And then it's such a big barrier because we might not get in contact with that veteran, and then days pass, they get lost in the system. It's just like, it's crazy how they add so many extra steps, especially when it comes to veterans, when there's organizations that, I mean, VA itself, you should have access to that.
And then the frontline workers are the ones that get frustrated because they're doing everything they can, but there are things before them. And so sometimes that might be just interviewing staff. You know, what do you see as pressure points? What do you see as things that cause lag or hurts the system? You can't just imagine everything on your own. So that's why sometimes it's good just to survey colleagues or you know, but asking these bigger questions and asking what the causes are rather than just dealing with them and complaining about them is a step in the right direction. You're going, why are we doing this? Can we change it? And sometimes it might be going to leadership. Sometimes it might be going to city leadership, county, state. You never know. It could be all the way up at DCF. And I'm going to tell you, a lot of those people are going to be at conferences like this, or a lot of those people are accessible. You just have to email them. You just have to get in contact with them. Try to call them. It's hard to believe the amount of impact we can have just by connecting with someone one-on-one, no matter how high they are up in the system. I mean, we had a congressman here, you know, yesterday. People could have stopped him and talked to him. You know, he's the one making a lot of votes. So we have access to people sometimes. It's just we got to take advantage of it. So I'm going to go ahead and wrap up. Like I said, if anybody wants to continue the conversation, feel free to email me. I'll be providing my slides, and I do virtual meetings, honestly, just to help communities because I really believe in this work, and I think we're all doing it together. And frankly, my best friends have come from doing this work and coming to these conferences. So I love interaction, and I just want to say thank you so much for being here today. You've been a great audience. Thank you.